This episode of Beauty and the Surgeon podcast is brought to you by Let's Get Checked. Let's Get Checked is an online company dedicated to making professional health testing easy and accessible. Let's Get Checked offers fast, affordable, completely confidential at-home health tests from a range of tests from STDs, male and female hormones, and even COVID-19. Listeners of our podcast who are new to Let's Get Checked get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com, trylgc.com/beauty, BEAUTY, and be sure to use the code BEAUTY20, BEAUTY20 at checkout. Do it. Getting tested is important. It's the responsible thing to do, and you know how important I think it is to make sure you understand your labs. Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon. Dr. Martin, how you doing?
I mean, as usual, I'm feeling very board certified today.
Well, that's good. It's an important thing. You are a board certified plastic surgeon, which is great because we're talking about something that you should definitely go to a board certified plastic surgeon to have done.
Probably. I think that if you're going to address this area of your body, you should go to an expert that's board certified.
I agree. So today we have a great topic. And if you're listening and you would like to watch the video and slides that go along with this podcast, you can find that on our YouTube channel at Jason Martin MD. While you're there, be sure to subscribe and drop us a rating and a like if you feel so inclined. It really does help us out.
And have your friends subscribe and rate and like.
That's right. If you like your friends.
Yeah.
So
and we don't care if you like your friends, just have them subscribe.
Do anyway. I was really surprised when I was thinking about podcasts that we hadn't done in a while or surgeries that we hadn't covered in a while. I was really surprised to find out how long it's been since we talked about facelifts.
All right, let me guess. Okay. Has it been a long time? You got to give me a hint.
It's been a couple of years, and I don't know the exact episode.
How could that be? Because it's such a commonly requested surgery.
Well, and I feel like we talk about it a lot, and I was like, no, we did a facelift episode really recently, but we haven't done it.
So
I think it was 2018.
19?
It's either 18 or 19.
18, yeah.
Yeah. Either way, it's been a while, and I kind of thought like a great way to go about it would be to talk about your perfect facelift. Like a lot of the comments we get from women, and we talked about this in How to Age Like a Hollywood Superstar, which was just a couple episodes ago. This is 104. That was like 99, 98, in the upper 90s. Because so many people, they come in and they're like, well, I'm just not there yet. I'm not there yet. I'm not ready. Like, oh, a facelift. Like that seems so scary, right? Like it seems scary. Or it seems like you're going to be judged or whatever reason that you think. Well,
there's 3 surgeries that everyone in the zeitgeist of like America that they have opinions about. That's facelift, nose job, and breast augmentation.
Yep.
And that's because every time they think of that, they think of some distorted looking person they've seen in the media. Have you ever heard a patient come in and say, I want a tummy tuck, but I don't want it too tight?
Right. Like, don't make my stomach too flat.
I really don't want a super tight stomach. Right. I want it like an average tight stomach. But they say that, for facelift, and we get it. We totally get it. I mean, some of these examples you see in the media are devastating. I mean, of noses alone. And so facelifts bring up those feelings, and we have to sit there and quell those feelings and et cetera, et cetera. Fortunately, we do this all the time. And a lot of the patients that come in are referrals, so they see actual examples. They know that someone doesn't look like, are we allowed to say names? We're not allowed to say names. Someone, imagine a rock star that's passed, that was really popular in the 80s, who I love, who, by the way, I took a picture by his poster.
Is this like we're playing $100,000 pyramid?
Yeah, when I was in 5th grade, I took a picture by his poster to send it to my girlfriend.
Aww.
It was a Polaroid. Look that up. Wikipedia Polaroid.
If you're going to facelift, you know what a Polaroid is.
Yeah.
Nils, what episode was facelift last?
It was Face and Neck-Lift.
Face and
It
Neck-Lift.
was May of 2019.
2019. All right. Well, so that was over 2 years ago, which is shocking.
You're just really deficient.
Yeah.
Is this a plastic surgery podcast?
It is.
I mean,
well, there's a lot of stuff to talk about, but where I'm breaking it down today, I'm really excited about because we're going to talk about how to find your perfect facelift by any stage in life, essentially.
Right. So you're breaking it down more toward age and presentation.
Yeah, because both matter.
Right.
Age does not necessarily directly correlate to presentation.
Right.
And we have examples of that too. But before we get into any of that, let's talk about the statistics because I love my statistics. And we finally do have statistics from 2020,
nice.
Which is great. There was a little bit of a delay in those.
Well, it had to go down because of things we can't talk about.
Yeah, so there was a little bit of a drop, which there wasn't a huge drop, which I think is really good. I mean, it's 11% change from 2019 to 2020, which is not super statistically significant. all those
Can you say that again, please?
statistically significant. Yeah, but there was a little
We're
bit
professional.
of a drop.
We're professional.
I'm
We're
a
very professional.
native English speaker.
Yeah.
Don't let me fool you. But there was a small drop, but that's
Still,
kind of
there
what
was
we'd expect.
230,000 facelifts in the United States, and that's only through the American Society of Plastic Surgeons, or ASAPs, which is the aesthetic plastic surgeons. That doesn't include ENTs and OMFs and all these other board-certified people that are doing these procedures. So I'm sure it's over 300,000, I'm sure.
Yeah, that's what I mean. I think it's probably an insignificant drop in the number of cases. So that's pretty cool. So it is a very commonly done surgery, probably more common than a lot of people think. I think the great thing about a well-done facelift is no one knows.
You don't know. We've said this multiple times.
Yes.
We've had patients come in. They're like, I want a natural facelift to get it done. They're so happy, extremely happy. And then their son comes home from college and doesn't notice, and they get distraught. Why does my son not recognize how wonderful I look?
Well, because you just look like yourself.
Right. And also your son doesn't care.
Yeah.
That's another thing I want you to know. Men who are 21 years old do not care.
What their moms look like, yeah.
And how do I know that? Because I was 21 and male at one point in my life.
And you have a mom.
And I have a mom.
Mm-hmm. Yeah, so
I knew she was there.
you just didn't really care about her facial aging?
No.
Yeah. No.
I don't even know what color hair she had at that point.
So let's break it down by decade. So I started with the 40s. While it is not entirely outside the ballpark of normal to have a facelift in your 30s, it is pretty rare. It's usually in cases where someone maybe has a really premature aging or has a skin disorder that causes their skin to sag prematurely.
Right. Ehlers-Danlos, we've talked about that.
Yeah. They've lost an
cutis
extreme
laxa.
amount of weight.
Yep. There's all these different types of, and they're not common, they're very rare conditions where people get premature aging and their skin loosens. Also, if you have someone with massive weight loss at an early age, sometimes that skin does not bounce back. And we've seen that before too.
Yeah, they just have laxity. And so usually usually you don't start doing these bigger facial procedures until you're somewhere in your 40s. But there are minimally invasive options, mini neck and facelift. We've talked about face type before on the podcast, upper eyelids, other little surgeries that are not maybe a facelift, but definitely make an improvement in the aesthetics of the face.
Well, mini face and neck lift is technically a facelift.
Yeah.
And when you do blepharoplasties or eyelid surgeries, that is affecting the aesthetics of your face. When you inject fat from your flanks or your hips and your belly and you inject it into your face, these are all things that people in their 30s and 40s do for sure. And face tight. Face tight has been transformative to our practice. And face tight primarily is for the jawline and below, but that's where people age first mostly. Besides loss of volume or descent of volume of your mid-face, which is why people get fillers in their cheeks, you see this aging along the jawline and aging along the neck.
You start to lose that angle. And if you go onto our Instagram page at JasonMartinMD.
What do you have going on over there?
Nothing.
We're going to have to break down Amy in this. We can break down each other and see what...
No, definitely not. No.
Yeah.
No.
Don't you care about the audience?
No, we're not doing that.
I'll do it.
No, thank you.
I don't care.
No, thank you.
I'm proud.
I'm not here for a consultation.
We're going to definitely do that by the end.
No.
It's so wonderful when I find a trigger point because there's so few and far between.
Dr. Martin, you know how many times on this podcast you've said recently that you need to trade me out for a younger Amy?
You know what? If I can't get a younger Amy, I'm just going to have to redo Amy.
Well, that
right?
I'm
Make
fine
her younger.
with. But okay, how about this? Like, you bring it out, you better be ready to fix it.
That's a good point. That's a good point.
So I don't know if you want to go down that road.
Yeah, maybe I don't.
Okay.
I want to go on
Keep those
vacation
thoughts
this year.
inside
I don't
your
want to
head.
have to be stuck here doing work on you.
So once you kind of progress through your 40s into your 50s, that's probably the time for most people when you're probably past the point of these minimally invasive options. You probably need a full neck lift, maybe a mini facelift.
And obviously, there's outliers. You could have people that need a full face and neck lift at low 40s. And then we just had someone recently just needs a mini face and neck lift, and she's almost 60.
Yeah. Or, just a neck lift, nothing on the face, or vice versa. There are a lot of variations within these. It's also when you start definitely looking at eyelids, if those weren't addressed in your 40s, it's most likely going to need to be addressed in your 50s to kind of balance out the face. And then skin resurfacing. So if you've been ignoring your skin up until this point.
Which everyone does, at least in areas that are normal. Like if you're in California or Miami or something, probably not. But in normal places, people are always come in after like 10 years of sun damage.
Yeah.
Like, hey, how can you deal with this? Well, it would have been nice for you to come in, a while back, but we definitely need lasers, peels, radio frequency treatments. But there's a plethora of options out there that can help you. But for sure, as we age, it doesn't even matter your skin color. You're going to have skin changes externally that are
Yeah.
visible.
And if you don't address the skin, you can do a full neck lift, a full facelift on somebody, but if they have terrible skin,
Right.
you're not going to get the most bang for your buck.
This is where you do the analogy. It's always a furniture analogy. You have a sofa. Is that where you're going with it?
No.
Oh, you have a sofa, and the stuff you drape over the sofa, if that's irregular, then that's not good.
Oh yeah, no,
So
I
you-
would not
okay.
have. That would not have been my analogy.
Okay.
I have a lot of analogies, and that would not be one
Okay.
of them. But it doesn't do any service to ignore your skin, especially at this point. Like it's kind of now or never. Like get that skin in check. Into the 60s, this is where we tend to see men start coming in
Oh,
for
yeah.
facial aesthetics too. Men are pretty fortunate that they can usually breeze through their 40s, even through their 50s,
That's
maybe
what
do their
Nils
eyes.
and I are banking on that.
Right, you guys. But by the 60s, this is when we start to see men. This is also when we start to see women men coming back in for revision face and neck lifts. Typically at this point, it's going to be, at least if you've not had any facial aesthetics, it's probably going to be more on the end of full versus mini on all of these things. Fat transfer becomes a much bigger thing too, as you've lost a lot of your facial volume. So that becomes a bigger part of the whole
Yeah, and
conversation.
people always get frustrated, but basically as you age, you gain fat where you don't want it and you lose fat where you need it.
Yeah,
It's
gravity.
like- yeah. Or just loss of fat. So
Yeah.
it's weird that the cheeks deflate, but then you get fat on, for women, their saddlebags and their inner thighs, for men in their belly area.
Well, in the 60s, women start getting fat around their middle. They get that male pattern fat.
Yeah.
So that they don't like. 70s and beyond, typically these are people who are doing revisions or all in. These are the people who have waited till their 70s.
They're
their
like,
70th birthday.
We just had a lady like that.
I'm
She
doing it
said,
all.
I'm turning 70. I'm going to take care of business.
Yes. And if you know my feeling on this, if you've listened to our previous podcast, specifically the one about how to age gracefully, how to age like a Hollywood superstar, if you get to this point in your 70s, you kind of almost have to go all in. And this is where you're going to see a bigger change. It's harder to get subtle changes if you've waited this long.
Right.
So, and we have some great pictures we're going to show too. So again, if you're not watching and you want to see pictures,
YouTube
log
channel.
onto YouTube and
Subscribe.
join us here. So let's talk about the different types of facelifts. We've shown these slides before, but I think they're really good. I mean, because this really does do a great job of breaking down the different types of facelifts. This is a picture just kind of showing all the areas that can be addressed. We've talked about these
It's a
areas.
depressing picture. Go back to that.
Aw, don't make fun of her.
I know, but it's just like, really?
She's a drawing, by the way.
I
So this
know.
is not a real
An
person.
actual person. They just tortured this person, gave her every problem, but that's fine.
Yeah, one of the things I didn't mention on my slides about decades is brow lift, and that's something that definitely could be on really any of those ages.
Brow lifts actually tend to be in the more earlier ages
Yeah.
than 30s and 40s. People were surprised by that.
Yeah, so that's if you're not quite, or if you aren't ready to have your eyes redone, like let's say you had your eyes done in your 40s and your 50s, a brow lift may be what you need versus having your eyes redone.
Right.
So,
We have a great brow lift episode, by the way.
and blepharoplasty.
And we have a great blepharoplasty episode.
All right, so let's talk about the different types of facelifts because I think this is where people get really confused about
Right.
what kind of facelift should I ask for is something that people ask us, or what is the difference between a mini and a full?
Because that's where everyone comes in. My friend, let's say Joyce. My friend Joyce had this. This is what I need. And obviously you're not Joyce, right? And the face, you need to go to an expert. You need to have someone who's facile and can do all the different types of surgeries. You can be the same age. One person needs a neck lift. The other person needs a facelift. Some people need volume or fat transfer. Some people don't. So, it just really depends on your presentation.
I think this picture does a great job of showing the different angles of pull, and we've talked a lot about that before. And also the incision placement too is kind of the key difference on a lot of these subtle differences in a face and neck lift versus a mini versus a full is a lot of times just a subtle difference in the length or the extent of the incision.
Right.
How far it goes down into the hairline, how high it comes up in the front. Those are really the big differences. I love this micro mini lift.
Right.
That's very cute.
Micro mini.
Micro mini.
Yeah. So if you're not watching on the YouTube channel, you should. But if you're not, it's okay. I can explain it. So always for any type of face and neck lift procedure, you're going to have incisions around your ears. Amy, how can you describe where those, at least in our hands, where that's located?
Yeah, I think around the ear is a good way to describe it. So if you were to trace a line, all the way around your ear in the front and the back, that's where that incision goes.
It's hidden in the creases. It actually goes inside the ear, the tragus, which is what Amy said previously on a different podcast, is what you push down when your kids are yelling at you and you can't hear, I can't hear anything. And then it goes down to the crease behind your ear and then sometimes onto the hairline behind your ear.
Or in front. the
Or even
hairline
in front, yeah.
Mm-hmm.
Depending on where you need. If you need the face, it's going to be more directed toward the scar's going to be more, more long on the front. If you need more of a neck lift, it's going to be more long on the back and of the front and back of the ear itself. So that's how you tell it apart. And from there, you can have these, different types of lifts, mini lifts, a micro mini lift, a micro mini lift. I just made that up. But, all these different types of
Invisible
variations.
lift.
Exactly. And that length of that scar is really dependent on what you're treating. People get really hung up on scars, number one. So I can say categorically, at least in our practice, in our experience, these scars heal really well. Amy saw someone who was 2 weeks out, and
One week out.
1 week out, and you could barely see her scars, and that's like legit.
It was really crazy. It was on one side, looked completely healed. I mean, I would have sworn that she was 3 weeks out on one side.
Right.
It was nuts.
And the other side looked normal.
Looked normal for
Yeah.
a week.
But she was only a week out. So by a couple weeks, these scars are really not visible with your hair down for females.
Even with your hair up. They're
yeah,
hard to see.
Hard to see.
I mean, when was the last time you stared at somebody's ear? I mean, I stare at your ear all the time.
I
but
stare at your ear too.
I mean, I only stare
I
at
think
your ear
you need
because
to
I'm sitting
stop
here.
getting in my space.
Can't help it. You're right there.
Yeah.
I just got that ear.
I feel you staring at my ear right
I
now.
am.
This is really bothering me.
But I mean, when was the last time you stared at somebody's ear?
Me, like a normal person,
Yeah.
never.
Right.
So you look at people's eyes and lips. You don't look at their
Right.
ears.
That's-
Yeah.
what'd you do to your ear?
And would you? I actually, there was a lady who had cancer, and they closed it, and the ear was smaller, and she's like, "Oh, I have the smaller ear." And I said, "Nobody will ever notice that." So, and then the other thing that people say about the incisions around the ear that Amy gets all the time, we get in our clinic, is like when Dr. Martin takes the ear off,
Because there's an incision all the way around.
right? Where does he put the ear?
Where does he put
like
my
I
ear
do an
during
ear
surgery?
transplant. The joke we made during you remember this? The facelift one
Yep,
was that we
the
had a
little
small
bed.
couch or bed in the OR, and we set the ear over there.
Yep.
Obviously, that was a joke. We don't have a bed or a couch in the OR for the ear. We do not take the ear off.
There we go. This is a great picture that kind of shows that the ear stays in place.
Yep. And if you're looking at our YouTube channel, even if you're not, I can explain it. When you elevate the skin and you expose the foundation of your face, which is called the SMAS. Do you remember what that stands for, Amy? Nice.
No.
All right, we'll just let everyone look it up. We're not going to give it away. We'll give it away at the end. Maybe you can think about it longer. Finally, this is like the best episode ever. I'm just getting you left and right, like punches. So you can, the apneurotic layer, that foundation layer with muscles and fascia, we lift that. And that's a big part of a facelift. That's where the change from a facelift comes, and that's where the duration comes from.
That's where the length comes.
Yep.
Yeah. And I think one of the things that we don't do that we've talked about on previous podcasts is things like a thread lift or these kind of like non-facelift facelifts. Like there's a reason we don't do them. It's because they're not addressing the real problem of aging.
Which is the foundation.
Yeah.
So the skin obviously loosens. If we're using Amy's favorite analogy of a couch, the stuff that's over the couch definitely loosens, but also the foundation of the couch, just the frame of that couch, the cushions change. And that's a big part of aging. So when you lift and resuspend that foundation, that SMAS layer, it really does depend on the direction of lifting. And you can lift it more out towards your ear or more up towards your to your sideburn area. And that is what we call vector of pull. And the skin, draping of the skin is the same way. So this is where it gets really complicated. You can have lifting of that foundation layer in one direction, the skin's inset in a different direction, but that's where the nuances of the surgery make a big difference. And that is the difference between a good and a really good facelift, just so you know.
Yeah, and that's, I think, a common misconception that people think that we're aggressively pulling on the skin during a facelift, and that's not the case.
No, that was true in the 90s.
Yeah, well, because they weren't doing as much work on the SMAS. In that same vein, we had a patient recently ask about deep plane facelifts, and I think we talked about this briefly on our podcast episode. What's your feeling about a deep plane
Yeah,
facelift?
this is like such Groundhog Day because now I remember talking about all this stuff. We actually did this episode because I remember everything now. So there was a guy in New York who was where I trained, Rosenberg, real good surgeon, and he's ENT. And ENTs go through an ENT training, okay? And then they do a facial cosmetic fellowship. It's usually only a year. By the way,
ENT is ear, nose, and throat.
yeah, sorry. By the way, plastic surgeons do 6 years. So, but whatever. We can have a different episode on that. Invite an ENT in and we can duke it out. But, there's some really good ENT surgeons that do face and neck lifts. And that's, with facial plastic surgery, which is ENT, one of the things that was really pushed by them in their community was these deep plane facelifts, which I think are cool. Instead of staying on top of that apneurotic muscle fascia layer that's the foundation, they go underneath it. And
You're trying to give me all the SMAS words, aren't you?
Yeah.
Uh-huh.
I'm really throwing.
I hear that. I do recognize these words.
Superficial, musculo, okay,
that
system.
one.
Okay, yeah.
Yep, that's the one.
And they don't have to elevate as much skin, so they claim that they have less swelling, less bruising with these deep plane facelifts. So, and that's maybe true in some cases. I was trained in both ways. I think there's applicability for both types of approaches. The data, at least in plastic surgery, shows no difference in terms of long-term outcomes.
Well, and there's a downside to deep plane that we did touch on in that episode.
Which is the absolute one thing you don't want with a facelift, which is nerve injury.
Yep.
Because when you go underneath that muscle layer, that's where the nerves lie. And you better really feel confident that you're know where the nerves are and you can preserve them. It doesn't mean you can't do it. I do facial reconstruction sometimes. I'll have to work around nerves then. If you're competent in this area, you're going to be fine. But that definitely adds to the risk a little bit.
Yeah, absolutely. And I think that's when you're talking about a deep plane facelift, you want to make sure if you're getting that you're going to someone who absolutely feels very confident in their ability with that type of facelift.
Yeah, I do like deep planes. I do think they have their place. But no matter what, okay, this is put this way. Just simplify everything. Because when you start talking about this stuff, everyone just goes to sleep.
Oh, no, they don't. People want to know.
So you can't just pull the skin. Right, Amy?
Correct. And that's where we were at before.
Right.
Yep.
You have to address the foundation. The foundation is probably, I'm going to just throw a number out. This is just in my head. 70% of the whole surgery.
Yeah.
Okay. That skin
for the longevity, it's 100%.
For 100% for the longevity. So it's maybe 30% skin, 70% foundation. It's that much. And then, even if you add volume, then it's probably 70% foundation, 10% volume, 20% skin. That's how little the skin matters. If you just elevate the skin and take the extra skin off, it's not going to be a long-term fix, number one, and the patients aren't going to be happy. So you have to have a combination of fixing that foundation, fixing the frame of the couch, fixing the cushions, and then redraping the couch, which is the skin. Thank you for that great analogy, Amy.
That was great. Yeah, so that's really, and we have on our Instagram in one of our saved stories, the facelift saved story, I actually show Dr. Martin doing a vector of pull in a surgery, and it really shows you that once you've elevated everything up, what you have is just when you lay it back down, and this picture does a great job of kind of showing that too, all you do is you take off the excess. So we're not pulling abnormally. So being pulled too tight is a common concern that people have because that's what you've seen, right? That crazy windblown or startled look. That's not a well-done facelift.
Nope.
We're only taking off the excess. We're not pulling way more.
You just take out exactly what you need and nothing more. And that's where the skill comes in. That's where, and we do this stuff all the time, every week. So clearly, for someone like me and Amy, both of us, we're very comfortable with how much skin we take and all that kind of stuff. So it's like almost like rote memory for me at this point in my career. But it doesn't.
He is like a Jedi.
Well,
it's pretty amazing to watch you do surgery.
But that's because we do a specific type of facelift, which is like a natural facelift. Amy and I both have natural aesthetics. Our product, or what we do for a business, our service is natural results. We have to be honest with each other. Not everybody wants that,
nope.
Right? And if you're listening to this and you're like, Martin sounds like a complete natural loser, right?
Like I want to look like I got out of a wind tunnel.
I want to look super tight and blown up. Yeah, you go.
Yeah, or startled
right.
forever.
And there are people that do that kind of stuff. But most people, in our experience, anecdotally speaking, most people want natural results, especially for the face, because you cannot hide your face. You can hide your super tight belly that people are fearful of. You can even hide your breast. You cannot hide your face and your nose. And that's,
or your eyes.
Yeah, or your eyes. And that's even true with masks. You can tell that there's something not right. And it's unnerving if anyone's ever seen that. And, God bless the people that have actually had trauma to their face and disfigurement. You know that feeling. You feel for those people if you're a compassionate person. And that's the same way I feel when I see people that have had bad facelifts. We used to live in Aspen. We used to see it all the time, even famous people. It was devastating. I remember one time my wife hit me under the table and she's like, you have to stop staring. And I couldn't.
Yeah.
I felt responsible just because I was a plastic surgeon. And I obviously had nothing to do with that case.
Right. But you do,
Yeah.
you wonder how people get there. Another thing I love about this slide particularly is showing again that vector of pull and why it matters. And something that a lot of people do is, they'll kind of pull at their own face in an angle that's very unnatural. And, we'll gently adjust them and say, no, you don't pull like this, you pull like this. And it makes all the difference in the world. And you kind of see that how if you're not pulling in the right direction.
Right.
Things don't look right.
If you go so a vector of pull means the direction. Again, in healthcare, we have to make complicated words for everything.
Well, angle, vector of pull. Vector, I don't think is a confusing word.
Yeah, that's a math term, and everyone hates math. Like how many times do you go to a party and people are like, "Oh, let me tell you about my vector work." Nobody.
Never.
Everyone hates math, besides people that are mathematic people. So yeah, it's the direction of pull, and you're right, Amy. Like you don't want to go too up towards the top of your head. You don't want to go too to the side, to the back of your neck.
Straight back.
It's kind of a slight angle back. And you can do that in the mirror. Everyone at home. If you need a facelift, you can see. Like if you go too high up or too far back, it always looks a little bit different. But if you get right in the middle, in that vector of pull. And that's what I do in the OR. People are like, what is this magic sorcery you're doing? I'm like, that stuff you do in the mirror, I do that surgically once I have the skin elevated.
Yeah. And you show that in that YouTube. And it's, like I said, saved in our stories on YouTube. So you can see that in our highlight reel.
That would require people to know how to go through stories. I mean, do you click on the face?
It's in the highlight reel.
Okay, gotcha.
No, so you don't click on the face. You just go to our profile and the little bubbles at the top are our highlights. There's one called Facelift.
Gotcha.
You just click on that.
Nice.
Yeah. So he actually shows something very similar to this with retractors, just holding that skin and showing that difference between the angle. And something else I think people don't realize when they think like, oh, that's such a long incision. Like, can't you just make that micro mini cut and fix my whole face through a tiny little 1 centimeter incision? Well, you can't. And the reason for that is when you have excess skin, and you did a great job of showing when you push up, where does all this skin go? You have to finish it off. So a little bit.
And I'm sorry to interrupt, but it's like to reinforce the point you're making. Lately, we've seen all these types of newer types of procedures come out, these mini lifts with these small little incisions and these using threads and energy like FaceTite that we do all the time. If you have an excess amount of skin there, there's no amount of lifting that's going to solve that problem.
No,
right? So
it's
again,
like a tummy tuck.
Skin is only 20 to 30% of the procedure, but are they even addressing the foundation with these small little procedures?
That's just it. They're not.
So what are they really doing? And whatever they're doing is, and I guarantee it. And if you say, oh, Dr. Martin doesn't know what he's talking about, I do. I'm a board certified plastic surgeon.
My friend had a thread lift and it looked amazing for 1 year.
Yeah, 6 months to a year. That's what they last. And then over time, the threads kind of go away. Even permanent ones tend to lose their strength. And why do I know that? Because there's tons of data that shows that the strength of sutures change over time.
Well, and you have seen these threads when we've done facelifts. Right. They're still there.
They're still there.
Some people, or they're broken in pieces and everything else.
So we're all good with minor procedures and going into the dermatology office and doing these little things. We support that, but this is not definitive answers. And that's what this podcast is about. If you want to definitively change your issue, specifically for the face and neck, it's going to be something where you have incisions around your ear, and they're not going to be, a couple centimeters short. They're not going to be. They're going to be around your ear. That's the way it goes. Yeah. And at least in our hands, they heal just fine.
Yeah. So this one's just kind of showing some different incisions. Let's take a quick break before we come back, because we have some really awesome pictures to show. We're going to talk about some other things about facelifts, but let's listen to a word from our sponsors. Let's get checked.
Let's get checked.
Dr. Martin, I'm super excited to talk about our sponsor for this podcast, Let's Get Checked. If you've been a listener of our podcast, you know that we have never had a sponsor before, and that's because we're an educational podcast. We're not looking to monetize, and we also would never recommend something that we didn't believe in and or use ourselves.
So basically you're saying we're very choosy.
We're very choosy when we come to our testing, but Let's Get Checked really aligns with our values. We talk a lot about monitoring your blood values of certain things. We talked recently about vitamin D serum levels. We talk a lot about hormone levels, and it's hard for some people to get to a lab, or you're afraid of the blood draw, or just, you're concerned about confidentiality. Like you have a lot of concerns and you just don't do it. Let's Get Checked makes it super easy because it's completely confidential. You do it from your home. So there's really no excuse not to do it.
Yeah, and we did it recently. Both Amy and I did it. She looked at her women's health, basically her hormone levels, and I looked at mine on the men's health side with testosterone. It was very simple. You go online. Their online interface is really easy to use and good. We got the testing kit very quickly, And the test itself, actually doing the stick, you do a stick on the end of your finger, is not hard to do. It only took about 3 to 4 minutes. You put it back in a sealed envelope that's confidential, goes back to them. You get your results in 2 to 5 days. It's really that simple. And the best part is it's about empowerment, about you taking control and trying to do things that are positive for your health and life. And this is one way to do it literally from the comfort of your own home.
Yeah, so they offer a wide range of tests. So they do men's and women's hormone panels. They do a full panel of STD testing. They also are now offering a COVID-19 test at home. So there are a lot of other just basic blood levels that you can get tested as well. And one of the things that we always say is you can't track what you don't check. So you might not know what's normal for you in the future if you're not checking it now, especially as it relates to hormones. And men's health specifically, I feel like is a little bit undertreated. I mean, sperm counts are dropping by a large percentage in men these days. Most men struggle at some point in their lifetime with low testosterone.
And those men do not know what the symptoms of low testosterone are. Depression, anxiety, sleep problems, osteopenia or loss of bone, loss of muscle, and something we treat all the time, gynecomastia or male breast growth. These are real problems that can be improved or treated with testosterone. And these men do not know their levels. It's so easy to get checked. And this is why we're so excited about the sponsor.
Yeah. And Let's Get Checked is a completely CLIA certified lab, the CLIA lab. So they're a well-established, completely safe lab to use. You do get contacted after, so you get your results. I got a text at 4:30 in the morning, which I loved, that my results were ready.
And we're both up at 4:30,
yep,
so that was good.
Super excited. And you have access to not only a nurse, but also a physician. So a physician does review your results, and it gives you a little breakdown of like where you're sitting on those levels. Dr. Martin's had even comparisons of like where 2 of the levels should be in relation to each other, which is a really important thing to note.
Right.
Just being within the normal range is not always enough. So it really gave more information than that. You'd still want to, of course, reach out to your own doctor if you needed some additional assistance with these labs or you did see something that was concerning. We didn't, thankfully, so that was good.
Yeah. We were both good. This podcast is about empowerment. It's educational. In my private practice, I'm a board-certified plastic surgeon. We are all about empowerment, and this is one way to do it. So we're very excited about the sponsorship, and we're looking forward to using it for our patients moving forward.
Yeah. So as a listener of our podcast, if you're also a new time user to Let's Get Checked, which a lot of you probably are, we do have a 20% discount code. So you do need to go to our specific URL, and it is linked in the description box below, but it's going to be TryLGC, so TRYLGC, like Let's Get Checked.com/beauty, BEAUTY. And you'll need to use the code BEAUTY20 at checkout. Beauty again is BEAUTY 220. And you can pick a test, like any test you'd like, put in our code and get your test shipped to you. Getting tested is the right thing to do. It's lets you know where you're at and what's responsible.
All right. Well, let's get tested.
Let's get tested. Let's get checked.
Let's get checked.
We're back.
Did you get checked?
We talked about that on a recent podcast that we needed to redo our labs.
I just listened to that episode.
So we need to redo our labs.
I know, we really should.
We should. So we think it's important. I do think it's important to check your labs.
Get yourself checked.
Yes. So back to talking about your perfect facelift. This is the question that I get from a lot of you listeners will ask, how do I know what to ask for? Right? And they think that they should ask for something specific when really what you should do is get input from a board certified plastic surgeon. And that's what I tell these people who reach out to us. You need to seek the advice of a board certified plastic surgeon.
With experience with face and neck lifts, because a lot of board certified plastic surgeons don't do face and neck lifts.
Correct. But I think if you're, getting a face and neck lift, that's, yes. Okay. Going to a doctor who does 300 breast augmentations a week and doesn't do a facelift, but every 10 years, maybe not your guy.
Not your guy. Or lady.
Or you're not your person.
Yeah.
Guy, non-gender specific guy.
Yeah, very good.
So I think that's really the most important thing, because as we talked about in the beginning, I broke it down by decade, but you saw that there was a lot of variation within that. And some people are going to be outside their decade, their aging decade. And we always say, for stated age, someone looks good or bad for stated age.
Or for chronological age.
Yep, for chronological age.
They look good for their chronological age. Mm-hmm. Or what do I say? They look
stated age.
Yeah. They look younger than stated age. Mm-hmm. That's what I say in my dictations.
Older than stated age.
Or older.
Yeah. So understanding your timing is really key also. Like I said, in the 70s range, if you've done nothing, it's now or never. Like it's time to do something or just not do anything at all.
Either way is fine.
Either way is fine. So, those are really key things. The other one that quickly follows that, when patients are in the office for a consultation is how long will it last? Everybody thinks that you get one facelift and you're done forever. that you somehow.
I mean, that's true in our office.
That
Amy.
somehow Dr. Martin can magically make you stop.
That's absolutely true.
Aging.
Don't listen to this liar over here.
Right.
Whatever we do, it lasts forever.
It lasts
guarantee.
forever.
We have a guarantee.
There are some surgeries that's the case, and we've kind of talked about that.
Okay, wait. Let's go through those real quick because it's always fun. Which one is it?
Tummy tuck. You don't gain
Tummy
or
tuck.
lose weight. I mean, we've
Right.
seen women in their 70s and
Brow
80s.
lifts can last a long time.
Oh, see, I think brow lifts are actually on the low end.
All right.
I'd put those at the
Yeah, I'm with
5-year
you. So
mark.
tummy tuck.
Otoplasty.
Oh yeah.
That's another one.
Ear pinning. Yeah.
Mm-hmm.
Thigh lift. Medial thigh lifts. No.
If you get one in your 30s, you
Yeah.
probably
that's
going to
good
need a
point.
revision in your 50s just because of aging. But definitely things like a facelift, like breast surgeries, those are things that, they have a time limit where you're going to continue to age. Gravity is still pulling down on these tissues.
Right.
Stuff's going to continue to happen.
And I like how the patients, they're so fun. But they're like, well, so you're going to tell me it's only lasting 10 years. Like I go in there and program it.
right.
Like I've put it. Like when I do the surgery, I'm programming. Okay.
2032, this
Set
is
the
gonna
clock
end.
back 10 years. Is it set back 10 years? Okay, good. And then when 10 years comes, like this alarm, the Siri alarm comes off. Like you need to go see Dr. Martin right away. It's aging. That's what happens. And
It's what's been happening.
Right.
It's what brought you here in the first place.
So if you're going to have aging of your breast or of your face, which is what happens with time, it's still going to happen after you get your face and neck lift. You don't stop aging.
But what it does do, and this is what I always tell people, is that you can never, you can't stop time, but you can slow it down. So if you're timing your surgeries
That's kind of
effectively,
deep. That's very deep.
yeah, you're extending the period of time that you just look really great. It makes you look more ageless. And that's, again, I keep referencing that podcast episode because it was so good in talking about how to have that ageless appearance. It's all about timing, but it never stops. So even the best done surgeries timed at the absolute perfect moment don't stop aging. They just help you age gracefully and they slow things down. So genetics and timing are going to play the biggest roles in how long your surgery lasts. If you do a full all-in everything at once in your 70s, that might be the only time you get a facelift.
Yeah.
If you're one of the less fortunate people who had to have a facelift when they were 36, you're probably looking at 2 more facelifts in your lifetime at least, and maybe other little things here and there.
And that definitely should go into your decision making. Maybe you wait till your 40s, try
If
to
you
line it
can.
up if you can.
Yeah. So that's, and your genetics, if you're seeing us prematurely aging, then the theory would probably go that you're going to continue to maybe prematurely age a bit, perhaps. Right. So expectations, I think, is also another key one here. People expect that their facelift is going to look the same it does on day one until, the expiration date at 8 or 10 years. And that's not true.
Which is, I think we excel at the expectations game. I think Amy and I are really good at communicating with our patients. Some offices, the surgeon can be really, really good, and they just really don't communicate well. And I feel for those patients because they come out, even though they'll say like this, I've had a great result, but
it's 5 years and look.
Yeah, look what's happening.
Yeah.
And they're like almost frustrated with their surgeon. I feel bad for the surgeon. If they would have just taken 5 minutes, and maybe they did, and maybe the patient didn't understand.
Well, people don't want to hear things they don't want to hear.
I don't know, well, but it can happen.
Push down on that tragus and you don't have
That's
to
why
hear
I say it 12 times. If you come see me and I say something 12 times, I'm trying to bring home the point. This is not going to last forever. Breast augmentation doesn't last forever. I say that at least 20 times before breast augmentation.
And you know how many people have told us that their original operating surgeon never told them that they would ever need another surgery on their breast implants? Lots. I would say almost 100% of patients who come to us for breast revision.
That doesn't bode well for these arrogant group of plastic surgeons.
And I think facelift is the same way. People do kind of have this assumption that if they just wait until they're 50 or wait until they're X age, that this is it. They can just do one and be done.
So if we get more subscribers, then we can have more flexibility with what we're doing with our YouTube channel. And then we can start getting songs and we can Don't Stop Thinking About Tomorrow.
No, you just have to sing those yourself. Because the more viewers we have, actually, the more that YouTube is going to. Yeah, it's actually worse. We could get away with it when we had no subscribers.
Should I get another job?
Once you're a big channel, they'll demonetize you in a second. You can't have one lyric.
Yeah, we'll pay for it. We'll pay for it. Nils will pay for it.
Good luck. Yeah.
He's a producer.
So let's talk about before and afters. I think we covered really.
This is going to be the best part of this podcast.
Yeah.
So if you're not watching, you're going to have to watch this, I think.
And if you want to hear specifics about recovery and downtime and some of the more specifics about facelifts, go back to our face and neck lift episode because we cover that in detail on that episode as well. This time I thought it'd be a little more fun to take more time and talk about pictures, which I get if you're a listener only. I apologize.
And everybody in this room are listeners. We all listen to podcasts.
Listen.
So we love our podcast listeners.
So we
We're
realize
not trying to
that,
push YouTube all the time. But
showing pictures.
Plastic surgery is a visual field.
It is.
Yeah.
Yep. So let's first talk about the 30s. And this is a face tight case. So this is minimal It's not a facelift. There was no skin removed in this procedure.
Right. So we've talked about face tight. Amy, what is face tight?
It is an internal radio frequency device, which I happen to have right
here we go. Props.
Because I always have it. So this little cannula goes in here. Radio frequency circulates between the inside and the outside, helps tighten skin. We also remove some fat with this procedure.
Right. So radio frequency is a form of energy, and it goes underneath your skin. And when the energy or electricity or whatever you want to call it transfers from the inside to the outside, it's bipolar. It meets resistance. And Amy, what happens when energy meets resistance?
Heats up.
Right.
Gets hot.
Creates heat. Heat destroys fat, melts fat, tightens skin.
Makes collagen. I mean, it's causing internal injury on some level too. So it's forcing your body to have to heal, which helps increase collagen production, brings blood flow to the area. You can see from this picture though, this woman is not overweight. She lost no weight between these two pictures.
So how old was she roughly? I mean, no, not the exact age.
34, 36.
Okay, like middle 30s.
Mid 30s.
Yeah.
Yep. Had a 8-year-old son-ish, I think. Had one child, and this was genetic in her family. This was just how her neck had looked since she was a young woman. The other thing that we did not do is give her a chin lift or anything else.
Right, and she technically is a candidate for a chin implant. And if you look at her after, it's pretty amazing. She doesn't need the chin implant. We just defined her jawline. We took away what Amy appropriately calls the selfie fat because she's of that era. You're so young.
I am not, but this person is.
Yeah. And that fat, when you're your chin's looking down, and
Never
it was like,
look down.
Always look up and hold the phone way up high.
Way high.
Really extend your neck up.
I think you'd call that the Tinder selfie. Like so that your body's not even in it,
You
just
had to
your
go
face.
to Tinder and Bumble. Okay. But anyways, yeah, so we took away the selfie fat, we tightened the skin and defined the jawline.
Yeah, and that was an in-office procedure. It took about 45 minutes.
Makes her look, more fit, makes her look
Younger.
technically younger and skinnier. So
Yeah. Yeah, and she's a normal weight patient. She's
Normal weight.
yeah, did not lose any weight. So if you're in your 30s and you're not
30s are face tight, 30s are Botox, 30s are blepharoplasties or eyelid procedures, maybe a little fat transfer if you need it for whatever reason. That's what 30s
I can't
are.
imagine you need a face or fat transfer to your face in your
We've
30s.
done blepharoplasties in the 30s.
Okay,
or
blast, but
eyelid tucks.
Fat transfer, not so much. Hopefully.
sometimes.
Hopefully you still got your baby fat.
Weight loss.
Yeah. All right. So let's look at the 40s. This is where we talked about maybe doing some mini surgeries, mini face, mini neck.
Or
And
as that slide said, mini micro,
micro mini.
which means super mini.
This patient, to be fair, was 49. So she
Okay.
was just shy of 50.
Just shy
So
of
she
50.
pushed it all the way to the end of her 40s. But you just see that, not a massive change to the neck. This was really just a mini facelift, just cleaning up the jawline.
But you can really see the jowling. That's what you start to see in the 40s is the jowls, the ill definition of the jawline. You see marionettes, they need a new word for that, which is those lines that come down from the edge of your mouth. Your cheeks start to descend. And we block the eyes out of all these pictures. That's what you're supposed to do. That's a responsible thing of facial pictures. But if you could see the eyes, you could see that her cheeks were lifted back up with this procedure. So many facelifts address the mid-face or your cheeks, the edge of the mouth, and the jawline. And that's exactly what she had. And it was a huge change. And we just did her secondary surgery.
10 years later.
10 years later. Because I pre-programmed in
Which
10
was
years.
awesome. Yes. So,
Computer, please program 10 years to last.
yeah. And I think this is a great picture that shows just how very natural, a mini facelift can look.
Yeah.
It's not scary. She looks like herself. She just looks better.
She looks better.
Yep. And there was nothing else that would have gotten her this result. So we could have done face tight on her. Yes, it would have helped a little bit with the jowling, but that would have really been it. It wouldn't have helped with any of that other mid-face stuff that you brought up. That really could only be addressed with a mini facelift.
Yeah.
We're pushing it now. So 63, right? 63 and 73 are our next two? Because they're the same. They're 10 years apart exactly.
Yeah, 63 or 64.
Yeah.
So when you get into late 50s, early 60s, mid 60s, definitely need a full face and neck lift.
Yeah.
And you'll see the problems. If you're looking on our YouTube channel, Jason Martin MD, you'll see her mid face. She starts to have that demarcation, kind of where the fat pad has dropped down. She almost has like a crevice that goes across her cheek. You can see marionettes. That's the line that goes down from the edge of her mouth toward her chin. Really bad jowls, and the neck is kind of a disaster. So, and the neck is really bad on her. Again, she came in complaining of her face. So interesting. So we did a neck lift and a full facelift. Obviously, we addressed the foundation. Remember we talked about before the foundation, 70% of the results. Redrape the skin really carefully and naturally. And she looks great. It looks actually amazing in these pictures.
Yeah, and she still has nasolabial folds. She's not looking like she's 40.
The nasolabial folds are the folds that go down from the edge of your nose to the edge of your mouth. And everyone thinks those are all going away. And I think it's funny because if you look at children,
They have them.
they have nasolabial
Yes.
folds.
Like, it
everyone
looks
does.
weird not to have
You know who
them.
does not? Monkeys. Okay, so
Exactly.
like, do you want to be a monkey?
No.
Okay. Was that too much?
No, I think it was actually very good.
Sorry.
And again, we have her ears exposed. So you can see like this incision goes all the way around her ear and down into her hairline, and her hair is pushed back behind her ears. So
We're way too transparent. We need to Photoshop, cover the ears. Everything needs to have like
that
a
would do
filter
a
on it.
disservice to people.
I'm
It's
joking.
better to
I'm
show them
joking. I'm
reality.
joking.
So, she still has some wrinkles around her mouth. I mean, again, she had done nothing up until this point when she saw us. She had not had Botox. She had not had filler. She had literally done nothing. So, blank canvas. She obviously needed a full neck lift. She needed a, mini facelift with maybe a little bit of an extension of her mini facelift. She did have an incision that came up into the hairline above the ear.
Where the sideburns would
Yep.
be. Yep.
So into
In the
that
hair,
hair.
yep.
But she looks great, and she looks age appropriate too. I mean, she just looks gorgeous. I mean, she looks stunning, beautiful. Okay, and this is
one of our favorites.
this is another great one. So this is, remember, exactly 10 years older. Same thing. She had not done anything.
So this is for those not watching, as a 70-something-year-old female.
Mm-hmm.
She has a real bad, grandmother neck, like the necks you remember when you were a kid.
Yes, and she, for a variety of reasons, was not really a candidate for a facelift as well. So this is just a full neck lift.
Yeah, so she really needs a facelift too,
Yes.
but wasn't a candidate for some medical reasons.
Yep.
So we only could do a neck lift on her, and it's just that's why I love this picture, because it's not like her results are perfect. Like she could still use the facelift, but it is almost perfect because she still looks somewhat like herself.
Yeah, and I mean, she's in
Right.
her 70s.
Yep.
You look at this, you just see that what I said about, being able to just really look amazing for your age is what the best kind of facelift does. You look like yourself. I mean, she's clearly the same person, looks like herself, but now she just looks awesome.
Oh, she does look awesome.
Yeah. And the one thing that you can't see through any of these pictures, and that I just feel so always just blessed is maybe not the right word, but the amazingness of our patients and just like the personalities and the spirit of these people you can't see through a picture.
Right.
And that's the thing.
And that
you
is
never
funny because
get.
every time you look at these pictures, it's like looking at your children,
Mm-hmm.
And I know by watching Facebook that sometimes I'm like, why do we have to have 12,000 pictures of your kids? Like I've seen Johnny at the game like 3 times, but like that's what it's kind of like with us.
Yeah.
So we look at these pictures. I'm not even thinking about the surgery. I'm thinking about her story.
Right. Like she loves to garden,
Yeah.
like all those things you think about with a person that just, there's so much more that goes into how someone looks than just doing the outside surgery, which is why it's so great to be able to help them make the outside match the inside.
Right.
Giving all these patients, the vibrance that they feel on the
And
inside.
empowerment. I mean, that's
Yeah,
kinda
showing
what
on the
it's about.
outside.
Yep.
Yeah.
So if you can see by these pictures, facelifts are not garish, not
They're
cartoonish.
not scary.
They don't look pulled.
You don't have
And-
freaky scars.
And we do different types of surgeries for different age people. It depends on what decade you're in. It depends on your presentation. Do you have premature aging? Do you have genetic issues that other people don't have? Have you had weight loss? Have you lived a life that's so much fun? We've had a few of those that they're
Have you
so
never worn sunscreen?
so sun exposed. You're like, was there ever a time that did you ever hear the word hat? Or
Shade.
like wuss or tree.
Umbrella.
Right. No, it was like they were up at the top of the mountain with their face right in
Naked.
the sun. Like, I love life. And I love those people, but they look terrible. So
Yeah. The one other take home that I will say from this episode that really kind of is meaningful to me is when people, I'll say like, oh, I'm absolutely getting a facelift. Like, well, you don't need it. I'm like, not today. But like knowing what's coming in your future of aging, I think is very empowering. So rather than thinking of a facelift as this horrible, scary thing or this giving in or this bad thing, thinking about it as, like you said, empowering and
yeah.
just beneficial to your overall aesthetic and how you feel about yourself. I mean,
And we've had
be excited about your facelift.
Exactly. And we've had tons of patients who don't do a facelift and still do other things and they're perfectly happy. So it shouldn't be such a negative connotation, and we get it. It's all about presentation and what's on the internet and where we are
Well,
in
now
our
this is on
culture.
the internet, so
Yeah. This is real life. This is the truth. If you are struggling with certain things related to facial aging and neck aging, there are answers, and there's like tons of answers actually out there. So just go to someone who's good. All right.
Yes.
So Amy.
I answered Avery. It's
Yeah,
fine.
that's my daughter.
14 years in, I answered
Before we
just
go,
about
we're not going to
anything.
break you down. We're not going to break you down.
Thank you.
What are we going to do for me?
Oh, no. We got to have that as its own episode. Someday we'll do that. There will be a day. But I'm telling you, that day you better be ready in the OR
If you
to
say
do my
lip
facelift.
fillers and
Your lips are amazing.
okay, what about We could do an otoplasty. We could.
Your ears are perfect too.
All right.
You're perfect. There's nothing to do. It'd be like asking me what I could do to Nils. Literally nothing.
I could do a lot of stuff to Nils.
Nils is perfect.
Down when he said that, too.
Oh,
Yeah, the little belly air. It's not bad.
well.
I mean, I think you and I are in competition, but
Yeah.
So thank you so much, everyone, for listening. Again, if you've made it this far in the podcast, we really do appreciate you listening. You can see on the bottom of the screen here, Nils is putting our phone number. I love that a lot of you have been calling and texting me lately. You can call or text this number, and I do check these voicemails. If you listen to our last episode, we
yeah, it's
answered
really
questions from viewers.
amazingly picked up.
People know
I mean,
that
you don't sound as desperate. I was a little bit concerned.
I
how is
still
this
sound
gonna
as
affect-
desperate, but I'm not.
It's kind of affecting our business, our brand.
Yeah. Also, we do really appreciate you liking and commenting. It helps us out a ton. And if you would be so kind as to subscribe, we know that not everyone is, wanting to know about all plastic surgery, but we're a fun podcast.
If you like this podcast, you like what you're hearing, subscribe. Yeah,
It helps us
Helps
out.
us.
All right, everyone. Have a great day.
See ya.
Don't forget to check out our sponsor, Let's Get Checked. Let's Get Checked offers fast, affordable, and completely confidential health testing for everything from STDs, male and female hormones, and even COVID-19, right from the comfort of your own home. And remember, new customers and listeners of our podcast get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com/beauty and use the code BEAUTY20, beauty, BEATUY 20 at checkout. Get checked. It's the right thing to do.